So today we're going to talk about brow lift. So if you look in the mirror and you look sad, or people are asking, are you angry or mad, or you're noticing extra skin above the crease of your eye, or there's just something about your eye that doesn't look like it used to, you might be a candidate for a brow lift. Now, what is a brow lift? A brow lift is where we are actually reshaping or changing where the brow tissue lives. Now, when people typically think about a brow, they're thinking about the eyebrow, right? Where the hairs are. But in fact, the brow subunit is actually this entire piece of soft tissue, right? It's distinct from the forehead and it's distinct from the eyelid. Now, it's important to understand what the normal anatomy is for a brow, because when we change something, we need to know what are we trying to get back to? What did it used to look like? In most people, the brow sits continuous, right? Or at the same level as the brow hairs. But in some people, that's actually not the case. So it's really important when a person comes to me and they're thinking about a brow lift, I have to think about, well, do you pluck your eyebrows? If you do pluck your eyebrows, where were they, right? Are you drawing your eyebrows in? Are they being microbladed? Are they basically tattooed? Because sometimes I have to change my entire approach because the eyebrows are not where they actually should be. So for example, if a person's had their eyebrows plucked and then they're drawing in their eyebrows higher than where their brow tissue actually is, if I try to do a brow lift on them, it might be the wrong move because I'm taking a brow that's already high and putting it in the middle of their forehead. Not a sexy, not a beautiful, not an alluring look. So all of these things come into play. Each one of us is born with our own native brow position, meaning where our brows are vary person to person and they give us our personality. So one of the biggest things that you can do to change the way a person looks is to change their brow. Now, our goal is to change the brow and put it back to where it used to be, right? For the most part. Sometimes people want a brow shape that they never had, but we have to talk about what that goal is because we don't typically want to do that. You end up looking weird like this person or like this person because they're just too high, right? It's a deer in headlights. The brows are part of our expression. So as we move our brows up, down, frown, little micro movements, the human eyes become very, very keen at noticing these and they impart the way we feel. So if you put a person's brow in the wrong position, you're gonna make them look like they're expressing or emoting something that they're not. And so that's where the problem comes into play. The other issue with brows is because one person might have a heavy brow or a more horizontal brow, and another person has a more arched brow, right? We want to restore them back to where they used to be. Now, if I take someone who's had a very horizontal brow like this, and I give them an arched brow like that, they are going to look wrong. They are not going to look right. There's also differences between men and women, right? A feminized brow looks different than a masculinized brow. The other interesting thing, super interesting, is that as time has gone on, right, there are different eras of when certain brows were popular, right? In the 1920s, brows looked like this, or the 1940s, they look like this, or 1980s, early 2000s, and now today, right? They all change in terms of the thickness, right? What is viewed as beautiful, right? Maybe it's this thin brow like back in the day, right? Or maybe we want a more bushy brow like in the 90s, or maybe we want a more high arched brow and off to a taper, right? Like something more modern. The most important thing is that we're trying to make the person look like the best versions of themselves. And so we have to be judicious because even though, you know, there's trends in terms of brows, ultimately, if I'm a surgeon and I'm moving brow tissue, I want that to always look good, right? Evergreen. It's not about the trend, it's about what looks good for you. When a person comes to me and they say, "Doc, I want a brow lift," or maybe they don't know they need a brow lift, and I have to let them know they need a brow lift, a lot of times we're dealing with the upper face, right? We're dealing with the eye and the eyelid. Because when you raise a brow, you get some lifting of the eyelid skin here. It can help with redundancy, right? That hooding that happens. So if you're doing a brow lift technique, a lot of times we're trying to address falling tissue or brow ptosis. There are several different ways of doing a brow lift. Let's talk about them. First off, we have an endoscopic brow lift. This is my go-to style of brow lift. It typically involves small incisions hidden up in the hairline, and it allows you to use a little telescope, a little microscope, right? Video camera system to get under the brow, free it from the brow, kind of the bone, so that you can bring it up and position it where you'd like to be. You then fixate, or basically hold the brow into position with various means. Sometimes I drill a hole in the bone and I basically create a little tunnel that can use a little suture to go into the tunnel and then grab some of the tissue of the forehead to bring it up. When I lock it into place, it stays, and then gravity resists it falling down. Another way of doing something similar is something like a endotine. This also involves drilling a small little set place in the bone. It's like a little hollowed out area that clips in to this almost suture-like material with claws, and those claws hold the brow into position. It's also a very popular technique. Other things involve sewing tissue to tissue, like a cable suspension. This is where sutures span across the entire brow, and when the tension is applied, they can create a little bit more of a lift, right? Reshaping. This is almost like a Fabergé egg, right? Like this kind of design. That's something where I do that for raising kind of the lateral end. And so I refer to that as a special type of endoscopic brow lift. I like to call that a ponytail brow lift, right? So if you hear the term ponytail, what it's referring to is the look that you get when you put your hair up into a ponytail and it kind of creates that nice elevation. What you're getting is you're getting a rotation medially and a lift at the same time. And so that's what a ponytail is referring to. So it's a special little modification of a brow lift. So we talked about endoscopic brow lift. Now let's talk about direct brow lift. So a direct brow lift is typically reserved for men or people with very heavy brows or asymmetry of the brows that's related to like nerve injury or cancer or something like that, because we are making a cut directly above the eyebrow tissue, removing that skin and then sewing it up together. It can have a more prominent scar unless it's a well-chosen person. Now, the benefit of this is you're able to not have to do all this special techniques of getting underneath the skin, avoiding the nerves, making sure you're in the right planes, because it's really just a skin type of surgery. But because it's skin, right, we want to make sure that there's not too much tension, because tension is the enemy of scars. And so you can get a really prominent scar here if it's not done the right way. But that is a direct brow lift. Typically it's good for bald men because there's no cut up in the top of their head. Bald people in general don't have hair to cover their scars. So if you can put it right here, you can get away with a nice lift. It's also a very strong lift because the lift of the skin that you're removing is almost like a one-to-one lift. Whereas when you're doing an endoscopic lift, right, when I'm lifting here, I'm further away from the brow. So you almost have to exaggerate the lift just a little bit to get it into the right position. That's a direct brow lift. Let's talk about the next type of brow lift. A mid-forehead brow lift, right? Or an indirect brow lift. This is a type of brow lift that you typically reserve only when I have to, right? I think I've done maybe one or two of these in my entire career because it involves making a cut in the middle of someone's forehead. Why the heck would I cut in someone's forehead unless I actually needed a good reason to do so? This is a great option for someone who has very, very deep folds in their forehead or rhytids, right? You've seen these people, they've got really deep set forehead wrinkles. You can hide a scar in those very nicely. Or if a person is very sick or they have a lot of asymmetry between the left and the right side, you'll get away with doing a mid-forehead brow lift. I don't like to do those even in those situations, so I don't do that often, but it is on the list. Let's talk about number 4. Number 4 is a temporal brow lift. What is that? A temporal brow lift is where we're lifting basically the tail or the corner of the brow in this area over here. We're not really lifting anything in kind of the 2/3 of the brow, the medial or kind of the central brow. It's just this area. And so with a temporal brow lift, you can get a really nice accentuation of the brow fat and a really nice arc here. It can look really pretty. Typically, if I'm doing a brow lift, it's either a temporal brow lift or an endoscopic style brow lift, but both are good options in the right situation. A temporal brow lift does slightly move the temporal pad here, temporal fat pad, as well as the temporal tuft. And so if you're getting a lot of lift, you have to be careful because you don't want to move someone's sideburn back too far. There are different modifications that you can use, such as sutures that span from the superior aspect of the scalp down to the brow, anchor and bring that up. And if you do it a little bit differently, you can get something like a cat eye, which I don't like to do. which is where you're actually changing the canthus and you're changing the brow very, very sharply. You'll see photos and videos like this on Instagram, on TikTok. I don't love it because it doesn't look natural. Humans don't look like this, and I only want to make people look like people, not like creatures. I just tend to avoid and stay away from that type of look. What are the other types of brow lifts? So there's a coronal brow lift and a trichophytic brow lift. What are these? These are older school style brow lifts, but sometimes they have their place where we make a cut all the way across. Then we remove strips of skin and bring it up. A coronal brow lift is done a little bit behind the hairline, and a trichophytic brow lift is done just in the little wispy villus or baby hairs in front of the hair. Typically, we're doing a brow lift like that if there is so much looseness here, because we want to really make sure we're lifting everything up. The other benefit of those techniques is it really allows you to craft both the lift of the middle or medial brow as well as the lateral brow. Now, the tricky thing about these techniques are you can put the patient at risk for having hair loss or alopecia if those hair follicles are damaged, and there's typically some sensory deprivation. So when you make this big long cut, the sensory nerves that basically start here in the skull and work their way up have to regrow. And sometimes people can end up with permanent numbness. And so that's a special consideration. But if you have a really, really heavy brow, person's got a really nice hairline, or if you're combining that brow lift with something like a hairline lowering, which I love to do, it is a good option because you're looking at everything. You can bring the forehead down and the brow up at the same time. So it can be very beautiful in the right situation. You just have to do it very, very nicely. Did I forget any types of brow lifts? I may have forgotten something. A gliding brow lift. A gliding brow lift is another newer type of brow lift where the skin itself is undermined and freed from the muscle. And then a quilted stitch is used to secure the skin to the muscle so that you're not actually doing a big release, but you're allowing the skin to actually just kind of shift upward. The beauty of this technique is that it doesn't require you being kind of next to the nerves. It doesn't require you dissecting and freeing around the orbit, but you can get a very nice, finely tuned kind of shaping of the brow. The downside, the reason why I don't use this is because you have to use those sutures that tack up. It looks kind of unsightly, and the other issue is those sutures aren't removed fast enough. You can end up with little spots of hyperpigmentation. Now, I deal with a lot of skin of color, and so it's not my method of choice. The other issue is once you release the skin and then you sew kind of the skin back to the muscle, you almost have to kind of just let it sit, and so it can be kind of bloody. You're not getting the same level of hemostasis you are when I actually lift things up. When I'm doing an endoscopic style brow lift, right, I'm lifting up the brow tissue, I'm in an avascular plane, or if there is bleeding, it's super minimal, right? That's why my patients don't look super bruised and swollen. And so all of these things go into play. What is the best brow lift for you? It depends on your face and what your goal is and whether or not we're combining it with an upper blepharoplasty, if there's some ptosis that needs to be corrected, really just depends on your face. So if you're interested in a consultation, you wanna know what I would do for your brow, specifically, reach out to my office. I'm happy to see you. Hopefully you guys have learned a little bit about brow lifts. We did a whirlwind lecture today. See you guys soon.